The ideal timing for prophylactic antibiotic administration before surgical incision is. Your correct answer is option B, within 60 minutes before incision. Which factor increases the risk of wound dehiscence? Your correct answer is option B, obesity. Complete separation of all layers of a surgical wound is called. Your correct answer is option C, evisceration. If evisceration occurs, the nurse should do first. Your correct answer is option B, cover the organs with sterile, saline moistened dressings. Which is the most common cause of post-operative fever within the first 24 hours? Your correct answer is option B, atelectasis. The universal protocol is primarily used to prevent. Your correct answer is option B, wrong site, wrong procedure and wrong patient surgery. Surgical site marking should preferably be done by. Your correct answer is option B, the operating surgeon or designated proceduralist. The nurse notices that a sterile package is wet. What should be done? Your correct answer is option B, consider it contaminated and discard it. The minimum acceptable urine output in an adult post-operative patient is. Your correct answer is option C, 30 ml per hour. Which patient is at the highest risk for post-operative pulmonary complications? Your correct answer is option B, chronic smoker with COPD. During the intraoperative period, the nurse's priority is to maintain. Your correct answer is option A, sterility and patient safety. Which type of anesthesia produces complete loss of consciousness? Your correct answer is option C, general anesthesia. Which complication is most commonly associated with spinal anesthesia? Your correct answer is option A, postdural puncture headache. Which postoperative intervention is most effective in reducing pain and improving lung expansion? Your correct answer is option B, splinting the incision while cuffing. A patient complains of severe calf pain and swelling on the second postoperative day. The nurse should suspect what? The correct answer is option B, DVT or deep vein thrombosis. Which operation is classified as an emergency surgery? Your correct answer is option C, ruptured ectopic pregnancy. Surgery performed to establish a diagnosis is called. Your correct answer is option C. Diagnostic surgery. Surgery performed to relieve symptoms without curing the disease is called. Your correct answer is option C. Palliative surgery. Which preoperative investigation is essential before administering general anesthesia? Your correct answer is option B. Airway assessment. Which score is commonly used to assess the airway before intubation? Your correct option is option C. Malampati classification. Which is the most common cause of airway obstruction in an unconscious postoperative patient? Your correct answer is option A. Tongue falling backward. The preferred method of hair removal before surgery is? Your correct answer is option B. Hair removal with clippers immediately before surgery if needed. Which action helps maintain patient dignity during the perioperative period? Your correct answer is option B. Providing privacy and explaining procedures. A patient receiving spinal anesthesia should be monitored closely for? Your correct answer is option B. Hypotension. Which postoperative breathing exercise helps expand collapsed alveoli? Your correct answer is option B. Incentive spirometry. The best indicator of adequate pain control after surgery is? Your correct answer is option A. Patient participates in deep breathing and early ambulation. Which complication should be suspected if the surgical dressing becomes soaked with bright red blood within the first hour after surgery? Your correct answer is option B. Hemorrhage. Which nursing intervention reduces the risk of pressure injury during prolonged surgery? Your correct option is option A. Frequent repositioning and adequate padding of pressure joints. Which patient should receive the highest priority for post-operative monitoring? Your correct answer is option B. Patient after open heart surgery. Before transferring a patient from the recovery room to the ward, the nurse should ensure what? Your correct answer is option A. Stable vital signs, adequate airway, controlled pain, and complete handover. Which type of surgery is performed to improve appearance? Your correct answer is option B. Cosmetic surgery. A surgery is performed to restore function after trauma is known as? Your correct answer is option B. Reconstructive surgery. The highest priority before administering pre-operative medication is to verify what? Your correct answer is option B, signed informed consent. Which pre-operative medication is commonly given to reduce anxiety? Your correct answer is option A, diazepam. A patient wearing nail polish is scheduled for surgery under general anesthesia. The nurse should remove it because it Your correct answer is option B. It interferes with pulse oximeter readings. Next one. Which item is usually removed before surgery to prevent burns after electrocautery? Your correct answer is option B. Metallic jewelry. Which positioning device is used to protect pressure points during surgery? Your correct answer is option B, foam pad. Which of the following is not a component of the surgical safety checklist? Your correct answer is option D, sign off. A patient with latex allergy should have what? Your correct answer is option B, a latex-free operating room environment. Next question. Which is the most common source of microorganism causing surgical site infections? Your correct answer is option B, patient's own skin flora. Which action by the nurse is appropriate when receiving a patient in PICU? Your correct answer is option B, assess airway, breathing, circulation, and level of consciousness. Which drain works by closed suction? Your correct answer is option B, JP drain. Which drain is an example of an open drain? Your correct answer is option C, Penrose drain. Which postoperative complication is most likely in a patient who does not perform leg exercise? Your correct answer is option B, DVT. Which electrolyte should be monitored closely in a patient with prolonged NG drainage? It's a repeated question. So, here your correct answer is option B, potassium. Which of the following is a major surgery? Your correct answer is option C, CABG or coronary artery bypass grafting. The purpose of a surgical skin antiseptic is? The correct answer is option B, reduce the number of microorganisms on the skin. Which antiseptic solution should be allowed to dry completely before skin incision? Your correct answer is option B, chlorhexidine alcohol solution. During transfer from the stretcher to the operating table, the nurse's priority is. The correct answer is option A, preventing patient injury. Which of the following is a common indication for placing a surgical drain? Your correct answer is option B, to remove accumulated blood or fluid. Perioperative hypothermia may lead to what? Your correct answer is option B, increased risk of surgical site infections. The Aldrich score is used to assess what? Your correct answer is option B, readiness for discharge from the PACU. Which document must be verified before shifting a patient to the operation theatre? Your correct answer is option B, informed consent. The abbreviation NPO before surgery means. Your correct answer is very simple, option B, nothing by mouth or nil per oral. Which postoperative complication is prevented by early ambulation? Your correct answer is option B, DVT. Which instrument is used to receive sterile instrument and supplies during surgery? Your correct answer is option B, myostat. Which position is commonly used for spinal surgery? Your correct answer is option C, prone position. Which type of anesthesia causes loss of sensation in a small specific area only? Your correct answer is option C, local anesthesia. The normal color of a healthy granulation tissue is. The correct answer is option C, bright red or pink in color. Which postoperative assessment should the nurse perform first? Your correct answer is option C, airway and breathing assessment.
तो इसी के साथ आज का हमारा ये वीडियो एंड होता है और अगला टॉपिक हम लेकर आएंगे गैस्ट्रो इंटेस्टाइनल सिस्टम यानी GIT सिस्टम के साथ, जो कि बहुत इम्पोर्टेंट होने वाला है। तो स्टे ट्यून्ड फॉर दैट और सब्सक्राइब करना ना भूलिएगा। थैंक यू फॉर वॉचिंग द होल वीडियो।